Is CGM, continuous glucose monitoring, necessary for diabetics and pre-diabetics? If so, exactly for whom and for how long? To know the deeper truths, remain with us till the end of this video. CGMs, which are non-invasive sensor-based devices applied to the arm, give sugars which are there in your interstitial fluid every 15 minutes, and that makes it very convenient for diabetics to know what is happening 24/7. They avoid the pricks to the fingers, the pain goes away, and they also give interesting insights on which food items are affecting the rise in sugars, how sleep and also stress is affecting the sugars. So there are definite advantages which people benefit from, but are CGMs really needed, and is it worth the hype created? First, let's talk about the accuracy of CGM vis-a-vis glucometers and venous blood. So, venous blood, which is taken in the lab, is most accurate. Capillary blood taken from the fingers through a glucometer is next level accuracy, and CGMs tend to be lesser accurate than both of these because they are picking up from the fluid in between the cells. So especially if there is a lot of fluctuating in sugars, you may not get very accurate responses. Also, we've been managing diabetics for the last 11 years. 16,000 people are free without CGMs, and we have found that whenever people take on to CGMs, usually the sugars show 10 to 15% less. So at times your decisions to change medications are not that accurate. For many people, we found at times it creates fear of food because the rise in sugars after different food items makes them label a particular food item as not good for them for life, which is not true. You may not be able to handle that food item right now, but within 2 or 3 or 4 months, you may be able to handle it better. So, CGM limited use for certain time can actually make some people move out certain nutritional food items from their food list, which is not good in the long run. Also, certain food items like maybe eggs or meat may not increase the sugar levels immediately in the short run, but they can increase acid and inflammation, which is the major cause of insulin resistance, and increase your weight and also your diabetes. Third is the intimidating cost, which can be between 5,000 to 10,000 rupees a month, boiling down to 1 lakh plus rupees a year, and that's not affordable to many. Of course, there are people who have extra money with them, and for them it may be useful and become like a status symbol that they are on the CGM continuously. What is concerning is a lot of pre-diabetics and even early diabetics are being put on CGMs continuously where it's not really necessary. So coming back to the first question, are CGMs necessary? The answer is no. It's not necessary for everyone. And for whom we should definitely go for CGMs. So those who are on insulin, those who are having high fluctuating sugars, and those who will have to prick their fingers many times and can afford it, can definitely look at CGMs as a via media to get an understanding of what's happening in their body. But for diabetics who are just on 1 or 2 tablets where the sugars are not fluctuating so much, and even for pre-diabetics where the value of CGM is very limited, if they want to experiment, they can experiment for 1 or 2 months and get insights into what's happening inside the body. Freedom from Diabetes has been able to get 16,000 plus diabetics free of medications, and many more thousands reverse their diabetes without forcing CGMs on them or making them dependent on CGMs. So if you want to learn more about how to reverse at the deepest level, working on insulin resistance on the deeper causes, Besides just sugar fluctuations, join the 1-year holistic transformation program now.